I'd like to talk to you today about how to sell GOCCLES in 5 easy steps. GOCCLES stands for Glasses for Oral Cancer Curing Light Exposed Screening. So GOCCLES are a pair of glasses that are fitted with patented filters that, when used in conjunction with a curing light, enables the healthcare professional to be able to do oral cancer screening. I'm going to talk about 5 steps to selling GOCCLES. The first is an overview of oral cancer facts, the importance of early screening, how to actually screen for oral cancer, how to incorporate GOCCLES into the oral cancer screening, and why you as a distributor rep should sell GOCCLES. Some facts about oral cancer. Oral cancer is one of the 10 most common malignancy cancers in the world. And the survival rate after 5 years is very low, especially when discovered late. So therefore, early screening is critical in defeating oral cancer. The main risk factors for oral cancer include tobacco, alcohol, sexually transmitted HPV, UV sun exposure, and various environmental and infectious factors. Oral cancer affects people of all ages, and we're seeing an increase in the amount of oral cancer in young people, particularly because of HPV, or human papillomavirus. Why is it so important to do early screening? As with many cancers, the earlier that oral cancer is detected, the better the survival rate. If you look at the survival rate 5 years from diagnosis, when the oral cancer is discovered at stage 1, survival rate is 94%. If we're waiting until the patient is self-referring because they have a problem that they're experiencing, we're most likely at stage 3 or 4. And then the survival rates drop dramatically to 27% and 5% respectively. How should a dentist or an oral hygienist screen for oral cancer? They would first take a medical, social, and dental history from the patient. They would then do a physical evaluation by palpating the external and internal jaw and mouth. They would do a visual naked eye inspection of the external, the neck and the jaw, and then an internal visual naked eye inspection. Once they have done that, they would repeat the inspection using GOCCLES. They would put GOCCLES on, they would illuminate the mucosa with the curing light, and then look for any abnormalities. GOCCLES works under the scientific principle of autofluorescence. So when a healthy cell is hit with the wavelength of a curing light, it gets excited and it re-emits light. Now you notice here in this picture, the glasses have green lenses. So because those lenses are green, healthy cells, when they re-emit light, will show up as green areas. Abnormal cells, because they don't re-emit light, will show up as dark areas. So that's all there is to it. The dentist does the visual exam, they add the glasses, they illuminate the mucosa with their curing light, and if they see a green background, that means they're seeing completely healthy cells. If they see a dark area, that means that that is an abnormal cell. Does not necessarily mean that that is oral cancer, but it does mean that the cell is abnormal in some way and requires further investigation. GOCCLES also allows the detection of margins of the lesions that are already visible. So sometimes you can see lesions with a naked eye, but then when you add the glasses and illuminate the mucosa with the curing light, you oftentimes see that the margins are much larger than what you can see with the naked eye. So if that lesion needs to be excised, we can ensure that that lesion is completely removed because we can clearly see the margins. Included in the GOCCLES kit are the glasses, a soft-sided case, a cleaning cloth, prescription eye lens cleaning, or a glass cleaner, and a camera clip for a smartphone. So if you look here on the right, you'll see that the clip has the exact same filter as what are in the lenses of the glasses. So you can put the clip over the lens of your smartphone, and then when you open your camera app, anything you see through the lenses of the glasses, you see through the camera. That enables you to be able to document what you've seen. If a dentist sees something of concern, they may do one of 2 things. They may have that patient come back in a couple of weeks and reevaluate the lesion, or they may refer the patient on to an oral surgeon for a biopsy. By being able to take a picture of the lesion, you can document it, and if you're having that patient come back, you have something by which to compare it. Or if you're referring the patient on to an oral surgeon for a biopsy, you have something to send along with the patient to the oral surgeon. Why should you sell GOCCLES? As I mentioned, GOCCLES is an FDA-approved medical device. For that dentist that is doing simply a visual exam, they're simply adding the glasses, they're using equipment they already have in their office, and they're significantly improving the effectiveness of the exam. GOCCLES does not require any aftermarket purchases. So some of the products that work under the same scientific principle of autofluorescence require patients to rinse their mouths. They require disposables. There are no aftermarket purchases required for GOCCLES. And I've had some dentists tell me that they're spending upwards of $500 every 6 months for disposables with other products. The MSRP for GOCCLES is $1,200. That's about a third of the cost of all the other products that work under the principle of autofluorescence. And the margins are very good for the dealer, up to 40%. GOCCLES allows the dental professionals to market a unique service to their patients and really differentiate themselves. And one of the things that I've heard from dentists is the question about whether or not they can get reimbursed for doing oral cancer screening. Up until recently, oral cancer screening was a part of the hygiene visit, and there was no specific reimbursement for oral cancer screening. ADA has now given a code specifically for a pre-diagnostic visual examination for oral cancer screening. So it is, obviously we can't tell the dentist what they're going to receive in the way of reimbursement. It'll be specific to the patient's insurance plan, but I've heard some very attractive reimbursement rates, and it wouldn't take long for a dentist to be able to recoup the cost of the glasses now that they're able to get reimbursement for oral cancer screening. There's a lot of support for GOCCLES. First of all, there's some great third-party support. It was reviewed by Dental Advisor and has been named for 2019 and 2020 a Dental Advisor preferred product for oral cancer screening. And last year, GOCCLES received a Silver Edison Award for innovation in dental diagnostics. Perel can provide you and the customer marketing materials that they can use to market the examination with GOCCLES. We can do information brochures, we can do posters for their offices, and we can personalize those with the dental practice information. We've got videos, tutorials, and instructions for use to be able to give to the hygienist and to the dentist to help them to know how best to utilize GOCCLES and incorporate it into their oral cancer exam. So oral cancer, as I mentioned, is one of the 6 most common oral cancers in the world, but with early screening, we can reduce the rates of oral cancer screening. And we can do this by encouraging routine oral cancer screening on every hygiene visit, and by adding a product like GOCCLES to a visual exam, significantly improving the effectiveness of the exam.